So the last thing is the exercise technique that I would use for my patient with the tendon repair. And so after the patient gets the dorsal blocking splint off and he's able to go through range of motion and uh, strengthening like without any issues, I would have him just do normal stretching of the finger. So both in flexion and extension. So we could do pass or active where he brings his finger into flexion on his own. And then I would passively overpressure once there's no pain. And then we could do for the same for each and every direction. He could do extension, get to full extension. I could actively do it, and we could do it at the DIP and PIP too if we felt that was necessary and those were lacking range of motion. And then the other one we would do is strengthening, and so we would do what we have talked about previously with the rubber band strengthening exercises. And so the patient could either do it between two fingers or he could do it between all of them at the same time. And he could do abduction as you're seeing right there, and then slowly bring it back down eccentrically into adduction. And then he could do extension of each digit compared to the other one. And then he could do it one at a time where he would just hold it and extend and go out to it. And he could do the same with flexion where he could hold it and almost do like a bicep curl with his finger, but do it with a rubber band. And so these would just help in the overall strengthening process of the hand and help to build up the structures around the tendons and make sure that something like what had happened previously with the patient does not happen in the future.